I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. AG1, the way I start my healthy days. With my AG1, I get a daily dose of vitamins, minerals, pre- and probiotics, adaptogens, and more. It's daily self-care for my busy life. It helps me fill the nutrition gaps, supports immune health, and supports gut for healthy digestion. It's once a day, easy to drink, and packed with bioavailable ingredients in a convenient formula. I am proud to have had AG1 as a sponsor of this show for many years. It's a nutritional supplement I stand behind and I take every single day. Start with AG1 and notice the difference for yourself. It's a great first step to investing in your health. Try AG1 and get a free bottle of vitamin D3, K2, and 5 free AG1 travel packs with your first purchase at drinkag1.com/Fiona Lovely. That's a $48 value for free if you go to drinkag1.com/Fiona Lovely. Check it out. Hey listeners, it's Dr. Fiona Lovely here with you today, and I'm thrilled to spend a few minutes with you today. I'm grateful to be in your ear for this little bit of time we have. And as always, I hope to deliver the goods for you today. I have a bit of an awareness piece that I'm going to share today. And then I've got a couple of questions for an FAQ. And these are hot off the press. This is the stuff the ladies are asking about in the clinic. And you heard it here first. So here we go. So October 18th is World Menopause Day. I know this has really just kind of recently come on the radar, hasn't it? And it's here to raise awareness on menopause and support options for us. And thank God, like, where was this information 15 years ago, right? But again, we're changing, it's changing, and it's because our generation, our bravery, our outspokenness is bringing a whole new era of menopause care for women and a menopause awareness. So I'm here to celebrate World Menopause Day, and I have a fun announcement at the end of this episode that I'll get to celebrate World Menopause Day. But before that, I want to share menopause by the numbers for you. I've been looking deep at these numbers this summer, really trying to understand why there is such a gap in care. And that is its own conversation for another day. But here's the numbers. There's 1 billion of us by the year 2025, which is just a couple of months away, that are in menopause or in the menopause transition we call perimenopause. 1 billion with a B. You are not alone. There are a lot of us going through this. Some have lots of symptoms, some have no symptoms, and every bit of the spectrum in between. This is the reality, and this is part of the reason it's so difficult to get great care. You just have to know where to look, it turns out. 47 million of us enter menopause each year. The ages of 45 to 55 are typically the most associated with the menopause transition, the most interesting in terms of changes to our bodies. and potentially symptomatology that can come up. But understand that perimenopause can start at 35 years old and last 10 years. Now, the hormonal shifts, 10 years. The neuroendocrine transition, that is the renovation that's going on inside the brain between 35, say 30 and 60. Okay, that is a neuroendocrine transition. We are just starting to understand that, thanks in large part to amazing researchers like Dr. Lisa Mosconi and Dr. Roberta Brinton, who are showing us what is actually happening to the brain and the brain structure because of the hormonal changes we experience. And so it's not just one day you stop ovulating. It's a whole cascade of things, and we're really getting a much better idea of what is happening just in the last few years. So I'm here for it. I'm excited to see how this is going to continue to unfold for us so that we can support each other better, so medicine can support us better. Chances are we are long in perimenopause by the time we recognize it's perimenopause. And as I said, it can start at 35. The brain changes can start at 30. What's really interesting is a lot of women in their 30s having their babies, thinking that what they're feeling is the baby blues or postpartum or depression because they've got youngins at home. And is that what it is? Or is it actually the hormonal changes of perimenopause? There's huge overlaps here in this time period. And I would say that it is not an unreasonable statement to say that many medical practitioners who are the ones that can help us with this, if we're talking about replacing the hormones that we're losing or supporting the hormones as they leave the building, then it's many of them just do not have the training. So we really have to be aware and understanding of that. So anyways, baby blues, maybe it's not baby blues, babe. Maybe it's actually perimenopause. I have a number of patients in my practice who had a later pregnancy and never returned to their periods. So that does happen. Okay, so let's get into the questions that are being asked. So the number one question I'm getting right now is, when should I start HRT? So it's a great question. And I think most of us, by the time we're asking the question about hormone replacement, we've either tried all the natural remedies like, and of course, HRT, hormones are natural. And so I just want to make that distinction right up front. But we're trying all the things that we've heard. Maybe it's fish oil, maybe it's vitamin D, maybe it's meditation, maybe it's, all the sleep remedies. There's a variety of them, herbals and otherwise. And maybe we've tried all of them and we're just at a point where we need more support. And that is kind of one of those things you want to be looking for. You feel like you're maybe on the road. You've got some things that work really well. For me, melatonin and magnesium glycinate worked for sleep for a really long time until it didn't. And that's when I knew that I had to reach out for support and for the best sleep remedy really for women in perimenopause is to top up the progesterone. And of course, we want to do that with bioidentical progesterone, not with synthetic progesterone or progestogens, they're called. That's a really important thing. And so you're looking at maybe not waiting until you stop cycling. First of all, you understand something. If you're going to the prescriber, the question you may get is, are you having hot flashes? Because unfortunately, that's kind of the classic hallmark sign of menopause. And it's a shitty one, to be honest, because there are so many more symptoms that show up more commonly than hot flashes. Me, for example, I had a stress-induced hot flash at the age of 40. But I haven't had one since, and I hope to stay that way. But I'm very definitely in perimenopause. So, push through that. push back a little. Obviously not still being respectful, but push back a little if that's what you hear. Because some doctors really have only ever been taught that we don't talk about hormone replacement therapy until a woman has hot flashes, okay? So if you're symptomatic, even if you're still cycling, I started my progesterone therapy quite a few years ago, still having a period, although skipping periods now, so that's kind of fun. It's kind of fun not being with them for a little bit. I thought I would miss her for a while. I was like, ooh, I think I'm going to miss you. Yeah, no, turns out, do not. It's all good. We've had a long relationship. We are complete. Now, hormone replacement therapy works incredibly well for relief of sleep issues, libido or loss of pleasure, or a loss of orgasm, or painful intercourse issues. So all the sex stuff can really be helped with hormone replacement therapy, and as well as hot flashes and night sweats. So you may be that person, which is, again, a very common thing, but not as common as we've been led to believe. And there are things that are far more common. Something else I want you to consider: if you are experiencing new onset anxiety and or depression, or worsening of those two things, chances are perimenopause is to blame, and the remedy is hormones. So let's talk about that a little more. So the next question that I get asked in the office quite often is, why don't I feel like myself, and where have I gone? And I say this with a lump in my throat and a sadness in my chest, because I have experienced this myself in the last few years. So let's talk about it. So the eventual decline of estrogen in particular, so estrogen during the early phases of perimenopause can have these wild swings and these wild dips while you're still cycling. And this is part of the reason that you can have the hot flashes, night sweats, and the heavy bleeds all at the same time, because, Mother Nature has a sense of humor. So why don't I feel like myself? It's because estrogen is leaving the building. And that happens in late perimenopause when we start to skip periods, okay? When estrogen goes, it can rob us of our self-esteem, our joy, our confidence, and our ability to connect. Connect to things and places and people that we have always enjoyed, but all of a sudden no longer have any interest in. Isn't that fascinating? So a woman in perimenopause is very easily misdiagnosed as having depression and anxiety, and then the prescription that's done for that is an antidepressant or an anti-anxiety medication. But what if the remedy that was appropriate was actually hormones? And we gave hormones so a woman felt like herself. She was able to connect to people. Like, it makes sense that you would lose connection, right? Estrogen, progesterone, testosterone, their job is to encourage connection and baby making. Let's just talk about the biology for a second. That's what they do. And so when they leave the building, when they leave our bodies, when they leave our brains are in a process of renovating those connections, those neural networks. And it takes some time. And I can say, having been through this, that if you don't have great supports around you, it's very easy to think that you did something wrong, or you're just getting old, or this is Alzheimer's setting in, or this is dementia setting in. By the way, I can feel you listening to this, and I can feel how it's landing. And so I'm so grateful that I have the opportunity to share with you. If you are feeling this way, boo, I get it. I was that way too. Last summer, 2023, I felt like the bottom just fell out on my confidence, which has not been a problem in my adult life, and my self-esteem, and I was comparing myself to everybody else, which I don't do that. Anyways, So when I talked to my prescriber about it, she said, when we're talking about brain fog and self-esteem, of which I had both at the time, she said, that's a testosterone problem. Guess what? Testosterone cream was like a switch, back on. Here she was again. It was so good to see myself again. And I'm so glad I knew quickly to reach out for help. It took a while to feel what was going on, to really be in tune. Like, there's just so much going on in our world right now. I thought I was just feeling crummy because I was sensitive to what was happening in the news and, with people around the world and war and politics and hurricanes and everything else. And it wasn't that at all. Actually, I was more sensitive to those things because I wasn't feeling like myself. So I implore you, if you have had a new onset of not feeling like yourself, babe, this is one of those things that is in the medical literature as known to be part of perimenopause. Reach out for help. There's all kinds of research that shows women who experience new onset mood issues, even just anxiety, depression, paranoia, even psychosis. The remedy is hormone replacement therapy before it's a psychotropic medication like an antidepressant or anti-anxiety medication. So I want you to know you're not alone. You are not alone. Please reach out to your prescriber. And if you happen to be in North America, I'm going to encourage you to reach out to one of the menopause platforms if your doctor will not prescribe it for you. Or here in Canada anyways, and I believe this to be true in the US, nurse practitioners are well versed in menopause care and well versed in hormone replacement therapy. And that's a great place to reach out if your own doctor is not acknowledging what you're experiencing. So gather your supports. It isn't personal, it's your hormones. When my mom was going through her early onset or the early stages of her dementia, she would just get so upset and angsty. And I would tell her, everything's okay. Your brain is lying to you. And I know that's really hard to hear that because you're like, well, how can that be? My brain and my mind are the same thing. No, they're not. They are not the same thing. So you can feel better. You can feel better quickly. And again, just having your people around you and having people you can talk to about this is so, so, so important. And actually, this brings up a tidbit that came up in conversation with Zora Benamou, who I interviewed for the show last week. I believe her episode's coming out in November. It may be early December, but she is a gerontologist and a menopause biohacker. Fascinating conversation, but we talked a lot about sort of the ageism and all of that. But she said community is probably the most important thing as we age. Having our girlfriends around us, having our friends around us. And I said to her, I said, I saw a meme on Instagram the other day that said, cultivate your girlfriend friendships because chances are you're going to outlive your spouse if you're in a hetero relationship. Chances are you're going to outlive your spouse, so you best have some girlfriends around. And I was like, woof, nothing like speaking the truth to make you feel it. Okay, hopefully that was helpful for you. I know this information has been life-changing for me, and for my patients, and I'm happy to share. So here's the little exciting news I can't wait to share. So in honor of World Menopause Day, I am relaunching my private membership group. I have had this before in the past. Some of you may have participated, and I'm relaunching it in a way that I am very excited about because it feels like a totally different experience. So this is The Gathering, I'm calling it, and it is the community of the Not Your Mother's Menopause podcast. And we need the space to get support and give support to each other. And so this is what my nesty, cozy, private space is offering you, should you choose to join us. I am going to be putting the video interviews of the Not Your Mother's Menopause podcast in that group. They will only be available there. You can catch clips other places, but the full video interviews will only be available inside the private group. And that's, of course, when I bring a guest onto the show. I will be inviting my guest experts to show up in the group and answer your questions. That will be coming in 2025, early 2025. I'm pretty excited about that. I recently participated in a friend's community Q&A, and it was just great fun. I mean, talk about this lovely, warm environment of just supporting other women. It was brilliant. So the gathering is a place to ask your questions and get answers, not just from me. I will certainly be in there, but also from the other members of the group. I mean, I'm sure at this point you've participated in other groups, and it's so fun to watch them grow organically and to just see what women do, what we've always done, which is come together and support each other. So I'm also going to be doing pop-up lives from, those are going to be me doing that. So typically that will be something juicy comes into the office. I'll pop on and share, because what I know is if one woman is experiencing something that she feels she's the only one, chances are there's a bunch of other ladies that are experiencing too. So I'll come in and share that in short format video, which is always a nice little digestible bite. And you, as the members of my private community, will get to ask the questions that become the future Ask Me Anything episodes. And this is a new thing I'm trying. I think it's going to be a really nice step towards you guys driving what you want to hear from me, driving the content forward. And that's really, really important. As I've gotten back to feeling like myself, as I've gotten my confidence back and my esteem back, I'm ready to be on the mic more. I have had a lovely couple of years of wonderful experts coming on the show. I'm very picky about who comes on the show. And I've never been disappointed. It's always been great, juicy, useful, entertaining, educational experts. And that will continue, but you're going to hear from me more too now. Ultimately, the gathering, my private membership group, which is launching as of the release of this episode, is going to bring you community, camaraderie, and connection. And I can't wait to see you inside the group. Now, if you're like, I'm not sure if this is for me, here's how you know. You're right for it if you're a woman seeking support. If you want the video versions of my guest interviews, which nowhere else are they going to be, you have questions and nowhere to ask. You want expert advice, but your doctor isn't available for it. I'm happy to give you that expert advice. So you can't rely on Google for solid menopause advice. I mean, sometimes you get lucky, but there's just a lot of crap out there. And I've been doing this for 20 years. I've been counseling women on the menopause transition for 20 years. And I love talking menopause to women. I just love it. So I would love to see you there. And again, you're right for the gathering. If you aren't sure how to talk to your doctor about menopause, that's a big one. Oh my gosh, so many women are like, eh. Here's what I heard recently. I don't want to be a bother. I'm like, wait a minute. Hold on a second. So, for sure, I knew my confidence was back when I said to the patient, when she said that to me, I said, just a minute now. I get paid to be bothered by you. Please bother away. Now, of course, she wasn't talking about me. She was talking about her medical doctor, who she was very much still in the I want to be demure and polite, that whole thin, pretty, and quiet thing, even for the doctor. It's bananas how we've been raised. But anyways, back to the program. So if you're interested in joining us in the gathering, I would love to have you. Love, love, love to have you. Please tell your girlfriends about it. We're doing an introductory pricing for it that I think is very reasonable. And the link will be in the show notes, or you can go to drlovely.com and click the membership tab. and all the information you will ever want will be right there. So, as always, it's been my great pleasure to bring you information today that's super useful, and I hope it was helpful. And I hope you take a moment on October 18th and just think about your own menopause journey and how far you've come. And the good news is, I keep hearing this over and over again from the ladies that are through it on the other side of the chasm of symptoms. They tell me it gets so much better. I don't know about you, sister, but I am looking forward to that myself. So it's been wonderful to spend time with you today. Thank you again for being a listener, being a part of my community, and I'll talk to you soon. Bye for now. The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.